This is the 5th annual Symposium that is a collaboration between the Provost's Office and the Urban Health Institute on the social determinants of health. And it was established and is intended to bring data and information to the complex social, health, and behavioral and well-being issues that face our community in Baltimore. We all bring our personal reasons for being here today. But let me say a little bit about what our outcome goals are. But before going there, let me just first briefly mention the process by which today was planned. In the fall, we held across Baltimore 4 consultations with community members, open to anyone across Baltimore. And we had over 120 people come to these sessions, share their perspectives, their ideas, their opinions, their suggestions, their recommendations, and from that, we molded this proposal and this project. The goals for today are simple to state, but I would suggest not so simple to accomplish. There are really 3 hopes that we have that you leave here today with. One is one clear thing that you as an individual will do differently because of reflecting on racism and how you want to change how you interact and do business. 2 is what is one institutional change that you would work to accomplish as a consequence of this? And 3, what is the one change that you would work toward in Baltimore to accomplish a more equitable community? So, what we are aiming for at the end of today are recommendations, ideas, plans that are concrete, that are specific, that are achievable, and that are not abstract, vague notions that sound wonderful, but will never come to pass. In the back of the book that you were given, the program, there is a racial equity action log. And we would ask at the completion of today that you complete it and that you submit it. It is a commitment for doing things differently. We have structured today as a forum for discussion. We have panels and presentations, but we have set it up so that we can all learn from each other as well as learn from presenters and panelists. Also in your program, there is a layout of the space, and the tables are numbered, and we each have a number that says what table you go to. We have trained facilitators at each table who will lead and facilitate the conversations, and there are questions that link with the panels that we will ask you to consider for discussion. We also will have an opportunity throughout the day for everyone here to pose questions. There are multiple ways of doing it. You can do it by Facebook. You can do it by Twitter. For those over 45, you can do it by email. For those over 65, you can do it by note cards. We have opportunity to contribute for every age stratum here. So please do raise questions. We will be collecting these, organizing them, giving them to the moderator, who will then facilitate the discussion. As I said, this is a collaboration between the Provost's office and the Urban Health Institute. And when I approached the Provost, Robert Lieberman, with this idea of a symposium today on race, racism and the future of Baltimore, he said, absolutely, this is a conversation that Hopkins needs to be part of. We're not the first to hold these conversations. They have been going on for years. But we now must move deliberately more forward. And it's not surprising because while he's the provost of the university, he also brings tremendous personal commitment and expertise to this issue. He has been a scholar of the effects of race and racism in political science, has written numerous books on it. And I'll just mention one article that came out last year entitled "After Racial Inequality After Racism: How Institutions Hold Back African Americans." This is the focus of his entire academic career, as well as a personal commitment. Join me in welcoming the Provost, Robert Lieberman.